Hi everyone, my name is Mary Kate Carden, and I'll be presenting No Level is Safe, Childhood Lead Poisoning Prevention for Pediatric Community Health Workers in Washington. My name is Mary Kate Carden. I'm the co-director of the Region 10 Northwest Pediatric Environmental Health Specialty Unit, and we are doing this work in partnership with the Washington State Department of Health. As a brief disclaimer, this work was funded by the Washington State Department of Health and supported by the American Academy of Pediatrics, as well as funded by the CDC, ATSDR, and EPA, who are funders and supporters of the PACU program, which I'll talk more about on the next slide. So for those of you who aren't aware of PACUs, or Pediatric Environmental Health Specialty Units, again, we are sponsored and funded by the CDC and the EPA. We are based at academic medical centers, and we're split into 10 regions across the country. In Region 10 at the Northwest PACU, we are based at the University of Washington in Seattle, and we cover states Washington, Oregon, Idaho, and Alaska. We are a group of medical, nursing, public health, exposure science experts in pediatric and reproductive environmental health. And in a nutshell, what our program does is offer free consultation services as well as outreach and education like this presentation to a variety of different audiences, but importantly, healthcare professionals like yourself as community health workers, as well as clinicians and other healthcare professionals. But we also speak one-on-one with families and provide education and consultation, as well as public health departments and other audiences. So I'd like to start first by just discussing what lead is and why kids are at risk of lead exposure and lead's negative health effects. So lead is a heavy metal that's found naturally as part of the Earth's crust, but it's also in a variety of different places and products in our environments today, either purposefully in products or in the environment due to contamination from previous uses of lead. There isn't any role for lead in the body, which means that there's no safe level of lead in the body. Lead can build up and cause lead poisoning, and kids' bodies are especially sensitive to lead exposure because they're rapidly growing and developing, particularly their brain, and lead can interfere with normal brain development. We call it a neurotoxin. It can also cause a variety of other health effects, but in kids and at levels of exposure typically seen in the United States, which is typically lower level exposures, we really worry about these insults to their brain development. So what are some factors that make kids higher risk for lead exposure? Kids are eating more dust and dirt and non-food items because they're exploring their environments via hand-to-mouth and object-to-mouth behavior. They have little to no hazard avoidance and are very reliant upon adults for protection. They spend more time outdoors, as we hope, but they also spend more time closer to the ground and engaging in curious behavior like playing in the dirt that may increase their exposure risk. They also have unique routes and pathways of exposure, so ways that lead can get into the body. And some examples of this are transplacental exposure, which means that lead is crossing the placenta from mom to baby in utero, and also the potential for exposure via breast milk. If mom has a very high lead level, they can transfer some of that in their breast milk if the infant or child is breastfeeding. Kids also have more years of future life, so there's the potential for greater cumulative or built up over the lifespan exposure as well as health effects that might not show up right away, might show up later down the road as a result of childhood lead exposure. So, thinking a little more about some key risk factors. Age is a key risk factor. Young children under 6 years old are at greatest risk of exposure as well as negative health effects. And this is because of some of the behaviors that we just spoke about. Also because younger children's brains and bodies are most rapidly growing and developing. So if they're exposed to something during that rapid growth and development, it could lead to greater, more serious health effects. Housing is another risk factor, particularly living or visiting, regularly visiting buildings or homes that are built before 1978. This is because this is the year that lead-based paint was banned for use in homes. The older the home is, the prior to 1978, the far more likely it is that it's going to contain lead-based paint unless there have been renovations done. Also thinking about where they're living, is it near a Superfund site or a site that's been designated by the EPA as having contamination? Potentially that's lead contamination. Some Superfund sites in Washington that are lead related that we think about is the Everett smelter or the Tacoma smelter. Poverty is another key risk factor. Being a child from a low-income family, being covered by Apple Health or Medicaid insurance, having a known sibling or frequent playmate that has an elevated lead level. And this is because if they're close, such as a sibling, or they're playing with someone all the time, they're likely to be in those same environments as that child, and potentially being exposed to the same lead that child is being exposed to get that elevated level. Being a recent immigrant, refugee, foreign adoptee, or a child in foster care. And this is because many other countries have less strict environmental protections when it comes to lead, and so there's a lot more environmental contamination of lead in many other countries. So coming recently from another country, especially those where we see a lot of folks coming with high blood lead levels. Afghanistan is one example of those countries. And being a child in foster care because potentially they've been exposed to multiple different home environments, and it's not always known what the condition or age of those housing environments might have been. Having a parent or caregiver who works professionally or has a hobby where they might be exposed to lead and can then track it home. If they use traditional folk or ethnic remedies or cosmetics, and we'll talk a little bit about this in a future slide. Have poor or inadequate nutrition, because kids absorb more lead on an empty stomach, and they can also absorb more lead if they have certain nutrient deficiencies like iron deficiency, which is already pretty common in toddlerhood. And finally, having developmental disabilities or other conditions that may increase risk of exposure. And an example that I usually point out is pica. It's a disorder in which you eat non-food items, and this is outside of that typical toddlerhood exploring your environment with your hands and by putting everything in your mouth. This is typically older children that are either mouthing or ingesting non-food items like rocks, paint chips, etc. that might be lead contaminated. So thinking now a little bit about where lead is found and what's some simple education we can provide to families to help them reduce exposure. So I always start by talking about paint. This is the source that most people are aware of when it comes to lead. And at the present time, housing age as an indicator of potential lead paint hazards in the home is the most established risk factor for lead poisoning we have. It's the most common exposure source in many communities. Excuse me. Again, particularly thinking about the older homes that were built before lead-based paint was banned. And thinking especially about homes that are in poor condition where there's peeling or chipping. This can create lead-contaminated dust and debris on the floors that can then be ingested or kicked up and breathed in by young children. Home renovations can create this kind of dust too, especially if families are doing DIY work or they're not using certified safe contractors. Some simple steps to reduce exposure via house paint, aside from doing an entire abatement or in the meantime, these are some simple steps that you can talk with families about to reduce their child's exposure. Keeping kids away from peeling paint, and if there's any repairs happening, keeping them away because that repair could be disturbing lead paint and creating dust and debris. Reporting peeling paint to a landlord if they're renting, and contacting a local tenants' rights org if the landlord is not making necessary repairs. Frequently washing hands, toys, passies, really anything that's going in children's mouths, frequently with soap and water in case there's any lead contaminated dust that's been on them, if they've been on the floors especially. Cleaning floors, window sills, and dusty places as often as possible, and particularly with wet mops and wet cloths, so you're capturing those dust particles. And really focusing on areas where there's a lot of friction, like windowsills as well as door frames, where the paint can become dilapidated more easily. And then using safe methods when doing home repairs that disturb paint. And the EPA has a really great webpage with certified lead-safe contractors that families can find if they're looking for that. Drinking water is another potential exposure source, and we're particularly thinking about older homes that have older lead-containing plumbing, pipes, and faucets. Public water systems regularly test for lead, so if you're on city or municipal water, they do regularly test for lead, and you can find those reports online. They're publicly available if you wanted to check. But homes that have private wells are responsible for testing their own water, and this is important when it comes to testing for lead, as well as other drinking water contaminants that can harm children. So when you're speaking with families, talking to them about their water source, especially if they have infants that they're mixing formula with tap water, this is an especially important thing to talk about for lead as well as other issues. Some simple steps you can give to families to potentially reduce exposure to lead via drinking water. If living in older housing, pre-1940s, so running the tap for more than 2 minutes after water has sat in the pipes for a few hours, first thing in the morning is the easiest way to think about this. This will help flush out any lead that may have accumulated in your pipes. If living in newer housing and are still just concerned or you're not sure about your plumbing and pipes, you can flush your pipes by running the tap until the water is noticeably cooler. Using only cold water for drinking, cooking, and mixing formula. Hot water can concentrate levels of lead in the water, so make it higher. So it's never recommended to boil water. This is not going to reduce or remove lead from the water. Cleaning the screens and aerators in faucets frequently to remove any captured particles. Using lead-free materials and piping when building or remodeling a home. And then also considering using a filter if you're not sure maybe about your water source, especially if you're thinking about mixing infant formula. This website, NSF, it's a third-party certifying body for filtration devices for lead as well as other contaminants. And you can look up anywhere from the one that you stick in your fridge, called a point of use filter, which is typically on the cheaper end, all the way up to a whole house filtration system, which are typically more expensive. Soil is another potential exposure source for kids. Lead can get into the soil in many ways. Some are listed here. Perhaps there's paint that's degraded around older buildings, and there's bare soil around those buildings that kids are playing in. Perhaps there's soil they're playing in that is near a busy road or near an airport. Some small aircrafts, as well as some off-road vehicles, still use leaded gasoline. And when those vehicles are in motion, that leaded gasoline can then become airborne and settle in the soil. If kids are playing in soil near industrial sources, such as battery recycling plants or other places, and then also if they're playing on or near agricultural land, previously in Washington in some places, certain pesticides that contained lead were used. And this is particularly on orchards that were functional before the 1950s. And some simple steps to reduce exposure: preventing kids from playing in bare soil and watching kids carefully, trying to prevent them from eating soil. Covering contaminated soil with a thick layer of clean soil. So covering it with soil that's not lead contaminated, or covering it with vegetation, mulch, or other materials before letting kids play there. Limiting access if you know that there's a contaminated area. Keeping soil outdoors and not tracking it inside by doing simple things like using a doormat, taking off shoes, washing hands before touching anything when you come inside after playing. Reducing exposure from pets that might go outside by maintaining proper pet hygiene. To me, this just means cleaning off their feet so that they're not tracking in any soil when they're coming inside. Washing produce well, peeling root crops, discarding outer leaves, not growing fruits or veg or other produce in contaminated soil if there's known contaminated soil. Washing clothes after coming in contact separately from other clothes. Washing, again, toys and pacifiers frequently. As a general rule, this is a good thing to do. And then hiring lead abatement contractors to remove or permanently cover the soil. This is going to be a bigger job and can sometimes be more expensive, but some of these simpler steps above you can give to families in the meantime. There are certain consumer products that through the years and through sampling and testing have been found to contain lead. Thinking about toys and costume jewelry, these are broad categories, but really thinking about the older and antique toys and jewelry that's been passed down, perhaps like toy cars in this photo. They've been passed down through generations from father to son, etc., father to daughter, and it's painted with lead-based paint. We've had consults just like this. And then thinking about costume jewelry, also thinking about that inexpensive children's jewelry that's sold in vending machines. I know that one of my favorite diners growing up had one of these machines, and I loved getting rings from them until they turned my fingers blue. Also thinking about dishware and cookware. Again, we're thinking here about imported dishware and cookware, older, handmade. Certain pottery have glazes that can contain lead. So if there's poorly glazed pottery that their family is eating out of, that could be an exposure risk. There's certain types of dishware like leaded crystal, pewter, and brass dishware that could potentially expose them to lead if they're eating or cooking and serving out of these. And then the bottom left-hand photo is actually a aluminum cook pot. This was a primary exposure source in a cluster of child lead poisoning cases in the Afghan community, refugee community in King County. This was a few years ago. So asking families what they're typically cooking with, what they're serving dishes out of, etc., may lead to some potential exposure sources. Thinking a little bit more about imported products, spices. Top right photo is just a picture of some spices. Lead can get into spices during many points in production, and spices are often grown in countries with more sources of environmental lead pollution. Like I mentioned before, other countries have less strict regulations, and so they have more environmental lead pollution. Lead can also sometimes be added deliberately to spices to increase the color, enhance the color, increase the weight, and thus increase the worth of the spice, unfortunately. There are certain candies that have consistently been found to contain lead. Many of these candies have been imported from Mexico. You can see on some examples on this infographic on the left-hand side of the screen. Particularly candies that contain chili and tamarind are more consistently found to be lead contaminated. Certain traditional medicines and remedies, Greta and Azarcon, are just two examples, typically used to treat colic or stomach issues in certain communities, but consistently found to contain high levels of lead. And there are other examples of traditional medicines and remedies that are used by other communities that have been found to consistently contaminate lead. And the CDC has a really nice webpage outlining some of these other products. And then cosmetics as well, thinking about kohl or kajal or surma. The bottom right-hand photo, this is a ancient eye cosmetic that's been banned in the United States for sale, but still used by many communities, and imported and brought into the United States, that's been consistently found to contain very high levels of lead. So thinking about reducing exposure via some of these consumer and imported products, just increasing awareness amongst families about products that have been known to be consistently contaminated with lead is important. Counseling families to avoid using some of these products and medicines and cosmetics, etc., that have been imported from other countries that have been found to consistently contain lead, and then helping guide families to find healthier alternative products, and recommending families use caution when using, again, some of these products or ingesting some of these products that have been made in other countries. And the Consumer Product Safety Commission is a governing body in the United States. They have a website that's basically a database of any recall that's gone out on any products in the United States. And so this website is super helpful. You can search by contaminant that you're worried about, like lead, or you can even search by the specific product if you have concerns that it might have lead in it. There are a variety of different jobs and hobbies where adults in the home may be exposed to lead at work, and then they can carry it home on their clothing and on their shoes and on their hands. Some of these jobs include painting, construction or home remodeling, radiator repair, battery or scrap metal recycling, pottery manufacturing. Remember I mentioned that glaze before. Working with guns and ammunition, and hobbies, stained glass work, glazing and firing ceramics, making and handling ammunition and fishing weights, target practice, again, handling ammunition, thinking about indoor and outdoor firing ranges, and jewelry making are just some examples. That's not an extensive list of either jobs or hobbies, but just some examples of ones that adults in the home are at risk of lead exposure and then taking it home to their families. Some simple steps to reduce exposure via this source include keeping kids away from work clothes and tools of household members who do construction work or other work or hobbies that may expose them to lead, and also washing work clothes separately from other laundry, removing them, as well as the shoes before coming into the house. Also thinking about the car, the vehicle that the adult is traveling home in, if kids are also going in that car, just keeping that space clean as possible. So moving on now to thinking about how lead can affect a child's health. So first, thinking about how lead gets into the child's body. You saw this picture earlier. The primary route of exposure, the primary pathway of exposure, is ingestion. So taking it in via the mouth. Inhalation is another potential pathway. And then one that's not on this slide, but I did mention earlier, is transplacental pathway of exposure, which is exposure if a mom has a high lead level and they're pregnant, that lead can be transferred to the baby in utero via the placenta. And so what happens to lead once it's in the body? This is a little bit of a complicated infographic, but all to say that after exposure, lead can be stored in the body for years. Once it gets into the body, it typically is in the blood for a little over a month, and then it moves into soft tissues and organs, such as the brain, which is what we're concerned about with exposures in kids. And then it can also be stored in the bones for long-term storage. And you can see here, this can sometimes be stored for decades. So how do we measure lead in the body if it's getting stored in various places throughout the body? The best way for us to assess what we call the total body burden of lead, and the most accessible way for us to do this, is by getting a blood lead level, so testing the levels of lead in the blood. This can be done either by a venous blood draw, which is pictured on the left-hand side, which as many of you I'm sure know, or maybe some of you perform this kind of testing, is definitely more involved, especially on those young kids. It can be difficult to get a venous blood draw. But it can also be done via a simple capillary finger or heel stick. And of course, this method is much easier in young children. So what is a normal blood lead level? We typically don't like to use this terminology because, as I mentioned at the beginning of this presentation, and as the title of the presentation suggests, there's no level of lead in a child's body that's really beneficial. However, there are many exposure pathways, and lead is kind of ubiquitous in the environment. And so the United States does a survey taking a representative sample of kids across the United States and sees how much lead typical children have in their blood. And a typical child in the United States nowadays has a blood lead level of less than 1 microgram per deciliter. So thinking a little bit about what blood lead levels correlate to what health effects. I alluded to this earlier, but the most common type of lead poisoning in U.S. children is these low levels, blood lead levels, or low levels of exposure. But through decades of research, we now know that even blood lead levels below 10 micrograms per deciliter and below 5 micrograms per deciliter even can lead to various learning problems as well as behavior problems. Remember, lead is a neurotoxin, so it can have negative impacts, especially on young children whose brains are rapidly growing and developing. Some of these behavior problems include ADHD and aggressive behaviors. Levels 10 and under have also been associated with decreased auditory acuity or hearing issues, as well as inhibiting growth. Very high exposures, seen typically levels 45 and above, at which we would treat the patient with medicine, are rare in the United States. These can even lead to just non-specific symptoms like stomach issues like colic in young infants and children. Constipation can occur, as well as anemia or a low red blood cell count. Extremely high levels of exposures, indicated by levels of 100 and above, are extremely rare. I have never encountered this in my practice. It was more common in previous decades when environmental lead pollution in the United States was higher. These levels can be life-threatening and can lead to brain swelling and seizures. So if the typical blood lead level of children across the United States is less than 1 microgram per deciliter, what do we consider an elevated blood lead level? An elevated blood lead level currently is considered to be levels greater than or equal to 3.5 micrograms per deciliter. And this value comes also from the National Survey of U.S. children that I mentioned previously, how they established that typical or normal value in U.S. children. This value of 3.5 micrograms per deciliter is what's called the CDC's blood lead reference value. This was updated in 2021. The previous blood lead reference value was 5 micrograms per deciliter. And the reason that they changed it is because this reflects a population lead level decline. They looked at the most recent 2 cycles of that survey that I mentioned and determined that population blood lead levels have decreased to a point that they can decrease the blood lead reference value. So 97.5% of children in the United States, based on this survey data, have a blood lead level below 3.5 micrograms per deciliter. So this value represents, if kids have a level of 3.5 or above, they represent the top 2.5% of kids with the highest blood lead levels in the country. And you can see on this left-hand infographic here how the times have changed throughout the decades thanks to several policies that have worked to remove lead from the environments of children, such as the banning of lead-based paint for residential use, as well as the removal of lead from gasoline for on-road vehicles. So you can see how this blood lead reference value has been adapted through the years. Back in 1960, the quote-unquote acceptable childhood blood lead level was 60. And through the decades, we've learned that there are significant health effects still at even these lower levels. And you can see all the way up to 2021 when they changed it to 3.5 micrograms per deciliter. So thinking now about screening and testing for childhood lead exposure in Washington, and by screening, I'm referring to asking questions to help elicit potential exposure sources of lead in children's environments. And by testing, I mean actually measuring the lead level in the blood. So when we think about screening, the recommendation currently is for providers or community health workers, people who are having contact with families and talking to them about their environments and potential exposure risks, to talk to them about lead at visits between 6 months of age and 6 years of age. Again, remember, children under 6 are at greatest risk of lead exposure and some of those negative health effects. And then testing, which we'll go over a little bit more in detail on the next slide, is recommended minimally at 12 and 24 months. And this is for children who are covered by Medicaid insurance or they have risk factors for lead exposure. And this is a tool that's been developed by the Washington State Department of Health. And it's a printable and online screening tool that can help guide conversations with families to help identify if there are exposure risks for lead. You can see in this top box, there are risk factors for exposure, most of which we spoke about earlier. But you can see at the bottom of that top box, there's the double asterisk. And this states that federal law mandates testing for all children covered by Medicaid insurance at 12 and 24 months. And this is regardless of if they have other risk factors for lead exposure. This should be taking place. There are also some exposure examples on the right-hand baby blue box, talking about some occupations and hobbies, as well as some consumer products. And again, this isn't an exhaustive list, but something to start the conversation with families about. So, which kids in Washington should get a blood lead test? Again, if a child is covered by Medicaid or Apple Health, a blood lead test should be done at 12 and 24 months of age. If a provider or you are seeing them after they've turned 2, but they're still under 6 years old, and they've never had a blood lead test before, then doing a blood lead test would be indicated. And again, this isn't a Washington State thing. This is a federal Medicaid requirement. If a child is not covered by Medicaid insurance, they're covered by some other insurance, then a blood lead test would be indicated at 12 and 24 months if they have risk factors that are identified through screening. For newly arrived immigrant and refugee children, there are other recommendations from the CDC for testing. Remember before we spoke about the fact that in many other countries, environmental lead pollution is higher, and so their risk of exposure is greater. And oftentimes we can see higher blood lead levels in these children than we typically see in United States born children. And so the recommendation is that newly arrived immigrant and refugee children, as well as newly arrived pregnant and lactating individuals, get a blood lead test at 16 years of age and under within 90 days of their arrival to the United States. So a quick knowledge check here, a question. Why do we test for elevated blood lead levels in children? Select all that apply, and I'll give you a moment to think about this. So the reasons that we test for blood lead levels in kids is B, to comply with Medicaid requirements if they're covered by Medicaid insurance. Also to identify lead-poisoned children who might not have any clear symptoms. Remember, as I mentioned earlier, even some of these higher levels that are more rare in the United States, their symptoms might be kind of vague, like abdominal pain, or symptoms that you can't see just by looking at the child, like anemia. And then importantly, we test because we want to be able to intervene as quickly as possible to identify and remove the source of exposure so that they don't have ongoing lead exposure. The reason that A wasn't one of the answers is because, unfortunately, there isn't one easy medication or something that we can do to reverse the effects of lead exposure. The most important thing is to be able to identify that exposure and remediate or mitigate any sort of ongoing exposure. So talking a little bit now about the care and follow-up of lead-exposed children. Is there a treatment for lead poisoning? So unless the blood lead level is very high, above 45 micrograms per deciliter, that's the level at which we would recommend that children be hospitalized and given a medication called chelation therapy to quickly reduce the lead levels in the body so it doesn't get to the point where the levels are so high that they're having some of those very negative health effects like brain swelling and seizures. So unless the levels are at this point or above, then the primary treatment, as I mentioned earlier, is to identify and remove the exposure source so that there's not ongoing exposure, to perform follow-up blood lead tests to make sure that the level is going down. If it's not going down, then that keys us into the fact that there might be a source that we haven't identified yet, or there's an ongoing exposure somewhere else. Monitoring growth and development with regular checkups, and this is particularly important because of those adverse neurological and developmental health effects that we talked about earlier that can be seen even at these relatively low lead levels. And then referring to an early intervention program such as Birth to 3 to support that child's neurodevelopment, to help, in a sense, offset exposure, and we'll talk about that on the next slide. So when we're counseling families of lead-exposed children, it's important to provide some context because this can be a really scary situation for families. Although lead exposure might not be reversible, it's not a guarantee that health effects will occur, and there are ways that we can support families to support their child's development to help, in a sense, offset the exposure. And this is simple things that I'm sure you're already speaking with families about. Emphasizing nurturing, safe, stable influences in environments and discussing the importance of some of these topics below, such as nutrition, educational enrichment, physical activity, safe environments, good sleep, etc. And the importance of good nutrition can't be understated in the context of lead exposure and poisoning. I'll show you a resource in a few slides that's called Fight Lead Poisoning with a Healthy Diet. And this is a really helpful brochure that can be given to families to educate them about the fact that lead is absorbed much better on an empty stomach. Up to 100% of lead can be absorbed on an empty stomach in kids. And it can also be absorbed better when children have deficiencies in specific nutrients such as iron, calcium, and vitamin C. So taking a brief moment to look at a case study or an example of where you could implement some of this education you've learned today. Let's say you're visiting with a family with a 15-month-old child who is found to have a blood lead level of 9 micrograms per deciliter at their 12-month checkup. The family talked about potential exposure sources with the public health department already, and the public health department and the family had identified that the most likely source of exposure in the child's environment was chipping and peeling lead-based paint in the house. What are some education points that you could provide for this family to help prevent ongoing exposure? Here are some examples of things you could discuss with the family. Discussing ways to minimize exposure to lead paint, chips, and dust until they can fix the underlying issue. These are things that we spoke about before, such as dust control with wet mopping and dusting, washing children's objects with soap and water frequently, and also simple things like hand washing frequently, especially before meals. Providing family with nutritional education and recommendations, focusing on some of those nutrient deficiencies that can lead to better lead absorption. Asking about follow-up appointments and blood lead testing, ensuring that the family has a plan to be able to get to these appointments and get the follow-up testing done so that we can ensure that the levels are going down. This is the best way for us to know that this education and mitigation strategies that we're offering to the family are working. And then asking the family if they have concerns about the child's behavior and development. Have they brought these concerns to their child's pediatrician? And seeing if they've been referred to early intervention services. And then finally sharing some resources, and we're going to go through some of those in the next few slides. So this is one resource that can be shared with families and is available online as well as to be ordered by the Washington State Department of Health or by the New Hampshire Department of Health, which is who developed this book. It's called Happy, Healthy, Lead-Free Me. It's a children's board book that can be shared with families about lead and children's health. It's available in 9 different languages, and I think provides an engaging story and pictures for kids that they'll enjoy it, but also provides a lot of really important basic lead education for parents as they're reading it with their child. Again, it's available online in PDF versions, which is most easily accessible. And there's also a video read aloud version at the site below. And physical copies can be ordered. And many state health departments have adopted this book and have copies in their offices that can be requested by clinics and by others to provide for families for free. And I mentioned this resource earlier called Fight Lead Poisoning with a Healthy Diet. The website is linked here. There's an online version as well as printable. This brochure contains meal and snack ideas that provide the important nutrients that we mentioned earlier that help kids absorb less lead. Many of the meal and snack ideas contain ingredients and foods that are offered in WIC food packages as well. The Washington Department of Health also has many lead resources on their website. They have a main page that has a lot of important resources, including resources for healthcare providers. And they also have a lot of free printable resources on their website as well, including posters that can be hung in offices to educate families about lead. They also have developed what they call a quick guide about lead, basically Lead 101 for families, the first page of which is pictured on the right-hand side. And they also have a variety of different other family educational tools, many of which are available in multiple languages. And then the Pediatric Environmental Health Specialty Unit, or PESU, has also a variety of different lead resources. On the left-hand side is a link to our Region 10 Northwest PESU website, and on the right-hand side is a link to the National PESU website. And again, I'll have our contact information up at the end of the presentation, but as I mentioned earlier in the presentation, we can provide individual consultation for families or for you or other healthcare providers involved in lead-exposed children's care for free at no cost. So just summarizing your important role in childhood lead poisoning and prevention. To be able to recognize risk factors for childhood lead exposure, help to counsel families on how to prevent lead exposure, understand how lead impacts children's health, help families receive appropriate screening as part of routine child health care, help connect kids with elevated lead levels to developmental services, and encouraging healthy nutrition, including iron, calcium, and vitamin C. And thank you so much for taking the time to watch this presentation and for your care of children in our community. I just wanted to provide some contact information. On the left-hand side is the Washington State Department of Health lead programs contact information, and on the right-hand side is our Northwest PESU contact information. If you have questions about this presentation, feel free to reach out to me directly. My email is at the very bottom of this box. And then in the future, if you have questions or would like some assistance with a specific case about a lead exposed child, that is our consult phone number at the top, as well as our consultation email. And we can conduct consults over email or over phone or both, whatever is easiest for you and works into your schedule. Thanks again for this opportunity, and I hope you all have a great day.